too. Hey, babies. They're not turning you out in the hamburgers, are they? Oh, shit. How far are you? 36? Oh, you're almost there. You having a girl? A boy? I was about to say a boy too at first when you were standing up. You scared? This your first one? Oh, good. Whose birthday is it?
Thank you. It's our,
It smells really good.
It is Mercedes' birthday. One of
Oh, and the banner's in here too. Aloha.
my birthday is I love the sign. I kept it up, but my birthday is 7/7. But every day is my birthday.
Oh,
So
7/7, July 7th. Okay.
Yes,
Well,
yes.
happy belated birthday and happy
Thank
birthday
you.
today too, since
Thank
every day is your birthday.
Yes, ma'am.
Okay. You want me to get up here?
Yeah.
No? Okay.
You can have a seat. Tell me what's going on. Why do I feel like I know you?
I don't know.
I just feel like we're connected somehow.
We may be, because normally when I see faces, I know them, even if the person don't know me.
I
So-
feel like that way with you.
Yeah.
Do you feel that way with me or no?
No,
You don't have to.
no. And normally I'm right, but my mind's been all kind of places the past couple months because I guess I've had a miscarriage. That's what we're here to see. My
Okay.
baby's no longer
Tell me
alive.
what happened with all this.
Well-
Because I was trying to get a little bit of information, but Teresa's busy. But she said something like you went to the hospital.
I
and they
came
didn't
here
see
first because
Okay.
I was supposed to. It was very hard for me to get a hold of anybody here. That was
Okay.
the first thing, and I don't
Okay.
want to blame them, but I kind of do because
Got it.
I was crying out for help for weeks, and I kept saying I'm in pain, I'm bleeding, I haven't had a period since 2004, so this is very alarming.
2004.
Yes, my period just stopped. No bleeding at all, no spotting, anything, and that was when I had
that
my
was 19 years ago.
Mhm.
Do you have children?
Yes, 5. So I've had a period before, but it stopped, and I still ovulate because people always say, "Well, how did you have children?" I'm like, I guess because I've gotten one before. I mean, if I've never had a period, then that'd be impossible. I'm
Right,
assuming, but I've got one before, so it was very alarming for me. And
This is pregnancy 5.
no.
You have 5 children.
Yes,
Did
I
you
have
have that before where you were pregnant and then like this happened.
Never. And that's why
No
again.
menses. Let me just get this right.
Okay.
Do you remember what month it was? 2004.
January. That's like an
Really?
estimate. That's what I have
Okay.
on all of my paperwork.
Okay, January 2004.
Yes, last menstrual.
Okay.
So I couldn't get an appointment here. When I finally did,
Mhm.
they wouldn't answer the phone. So what I did, I drove all the way here, and I was still on hold. What happened?
Stop. I just can't believe that this happened to you.
Yes.
You drove all the way and you're
Yes.
still on hold.
Yeah, I'm still on hold. And when I came in, somebody at the front, they called
Come in.
someone to come out.
She's done, room 28.
Room 28.
Yeah.
Okay.
Okay.
Thanks, love.
You're welcome.
They told me, I told them my symptoms, they took me straight to the hospital. And so the hospital, they couldn't see, I guess the sac, because I was so soon or early. And so they told me to follow up right away with
How
my
did you even
OBG.
know you were pregnant?
A pregnancy test.
Pregnancy test. Okay.
Yes, a pregnancy test.
Blood
So,
or urine? Sorry to interrupt.
urine.
Okay.
But the hospital did
And
blood
why
and
did
urine.
you think you were pregnant? Since
I mean,
you don't get a period.
I've had
you
so
felt
many. Yeah,
You're
I
I'm
just
pregnant.
know.
Okay.
Mhm.
Got
Yeah.
it.
Even though I wasn't showing or anything, I just knew I was, and I was correct. I took, I think, 3 tests to
Wow.
make sure,
Yeah, got
and
it.
they all came up positive. And the hospital, they did blood and urine, and it was positive, of course. And they said it was too early, and my HCG level was 1400 at the time.
Mhm.
And they said it was too early to see the sac, so they couldn't tell if I was having a miscarriage or not, but to follow up with the OBGYN.
Got it.
The story's too long to tell you how I finally got an appointment, but it was ridiculous. One day they had to reschedule it because I guess you weren't here.
Uh-huh.
Are you the only sonographer?
Yeah.
Well, they said you were
Yeah.
sick
Okay.
one
I had
week.
COVID, so I couldn't come in.
Yeah, well, I'm glad you didn't. But yeah, that was one issue, and then
Okay.
it was just prolonging, and they didn't, I guess, take my concerns seriously. I was really scared, and maybe they couldn't have done anything to prevent it, but I don't know.
Yeah.
But now,
I mean, generally, you know.
yeah,
you
if
can.
it just happened, it happens. But
Yeah. But still, the concern is, because you're young, so you, of course
oh
you
well,
can.
thank you, darling. Did you
Yeah.
look at my birthday?
Yes, girl, you're.
Oh well, compared to you,
baby.
you're saying.
Yes.
How old are you? If you don't mind me
60.
asking.
I'll be 60.
Aw,
Yeah.
you look good.
Thank you. It's in the dark. But my concern is because you don't have a period and you don't know to alert except that you know your body.
Mm-hmm.
But we have to make sure over the years, since you're not getting a period, and if you miss one, that you don't have a tubal pregnancy because that can be
Yeah.
lethal.
That's something they were checking for too.
Okay, good.
So they
'Cause
did
I'm gonna look.
They did that, and then they did the one on the
Internal.
inside. Yeah,
Okay.
yeah.
Right, let's see what's going on. So for future, that's something that they have to know
I need to
when
take
they're.
off my undies, right?
No, not yet.
Not
because
yet?
I'm gonna send
Okay.
you to the
Oh,
bathroom.
you're not doing the.
I'm gonna do transabdominal, then I'm gonna have you pee, and then we'll do the internal.
Okay.
Good. Put your leg. So, what are the ages of your kids?
18, 14,
Wow.
13, 6, and 3. 4 girls, 1 boy.
Where does the boy fit in the
He's
poor
the
boy?
second one, the 14-year-old. Yeah.
Is he like, oh my gosh, no more girls in
Like
this one?
he just, yeah, they all get on his nerve, and
The poor guy.
yes, but he's really close with the 18-year-old and the 3-year-old.
Oh,
Yeah.
you're kidding.
He would fight anybody about those two.
Oh my gosh. Okay, so I'm looking at the uterus. and
Okay.
I'm not seeing anything. I see a little cyst on your left ovary.
Assist?
Yeah, which kind of comes along with the territory, like if you're ovulating, that you don't know. When was your last? When do you think you miscarried? Because you could be ovulating already.
I don't know.
When
They
did you
told me.
have, at the hospital? When did you have the positive, honey?
Okay.
So
Which part?
This right here.
Okay, I see
Looks
it.
like an egg. There's another little baby egg, but this one looks like it's going to be the dominant follicle, and it looks like in probably about 7 days.
Okay.
You're going to be fertile. Can you tell when you ovulate?
No. That's why I'm listening to you really
Okay.
good, because I have no idea.
Okay, so what you do, because fertility was my specialty for like 10 years.
Okay.
Is you ever see like a clear mucousy discharge?
Yes.
When you do, that's ovulation, baby.
Really?
When you see that clear jelly.
Yeah.
So pay attention to that. What
Good
if
to know.
What if you came back and you were pregnant?
Oh, Lord.
Girl.
So it could be possible. Now you're just saying I'm ovulating now.
Right.
Okay.
Transverse left.
And it's so amazing how you guys can just look at this black and white screen and see everything, and it just looks black to us.
And can you? I remembered being so young, being in the field, and I said, I'm going into something that's a farce. They're all lying. They can't really see what they say.
Right.
You know,
And now
I
you've
was
been
like,
doing it
now
so
I'm
long,
like,
and you
yeah.
know exactly what
Yeah,
you're
so
looking at.
there's no egg maturing on that long right. This is the right ovary. No ectopic pregnancy, but since I'm never scanned you before, I want to make sure.
Right.
Because
You can tell how many eggs are there too, or no?
Yeah. You got some immature eggs on the right. I'll show you.
So what does immature
I'll show
mean?
you.
Like they're just no good, or?
No, they're good.
They're
just
small.
Waiting they haven't been turned on by ovulation. So God gives you all these eggs. Only one, unless you're having twins. One of these eggs each cycle will, like, see this egg and this egg, and then I showed you the bigger one. That's the mature. That's called the Graafian follicle.
So that both gray spots are the eggs on the right and left.
Yep.
Okay.
But the biggest one is on the left.
Okay. Wait, the left or my right? Is it my right?
No,
That's
I'm on
where-
your right now, and this is your right ovary. I already did the left. The left does.
Oh, so that's my left. Me looking at the screen. So, okay.
Yeah. Here's your left. See that big, dark, perfect, beautiful egg right here?
Yes, ma'am.
That is your left.
Okay.
Don't pay attention
To
to
the screen. Yeah.
this is
But I
your
can
left
feel you
ovary.
on my left. Yeah.
Yeah.
I'm just trying to know what I'm looking at.
Yeah,
Okay.
I'm trying to show you. And then you got little ones, baby eggs on the right, meaning this little sucker maybe next month will take off.
Okay.
And that one will grow to that one.
Okay.
I can't tell you that
Right.
this is going to progress into a perfect egg, but it looks nice and juicy.
So they're just not all scrambled. That's what I'm wondering.
No, they're good. You don't got scrambled eggs.
Okay.
Your toad's fine.
Okay, okay.
You're
Oh,
so funny.
gosh.
Okay, so we got these.
My 3-year-old was a twin.
Really?
Yeah. It never fully developed. So,
Okay.
yeah, the doctors told me that, and I got the pictures of both placentas and everything.
Aww.
Yeah. Yeah.
Cause how
Sarai.
old were you when you had her?
Sarai, she's 3. So, yeah, 3 years ago. She'll be 4 in May.
They might want it because they're gonna see you.
Okay.
I don't know whose schedule you want on, but anyhow, now set the probe up.
Oh, I thought you were giving me a cup or
I
something.
am.
That's
You're
what
gonna
I was-
come with me,
Okay.
but I'm just gonna. Hold on. Let me get the cup. Your bathroom is right across from the cabinet there.
Okay.
But I'll meet you at the top.
Okay. El baño.
No, I have to do it internal.
Internal. No.
Something's funny in there.
Yeah.
I love that tie-dye dress.
Oh,
Cute.
thank you so much. Okay.
So in there, just give
Just
enough.
as much as I. It is so amazing how many of these are ripped off. Put my underwear in the purse so they're already off. Just in case y'all didn't hear me, I was saying it's ridiculous how many of those phone numbers are ripped off for people that's going through domestic violence. I've been seeing them in a lot of bathrooms at the doctor's offices and stuff. Okay. Here we go for the internal ultrasound.
Put the urine in there.
Yes.
Ooh, and your date of birth is 4/28.
And I already have my undies off. I wrapped them up in some paper towels. So I have to take them off now in front of you.
You're fine. I'm
Okay.
just gonna have every time we do and he said, no, I'm splitting from you. So the best option was adoption, which was great because I got 2 great parents that adopted me. But to think that that MFer sat there in the foundling and they were giving him praise and glory.
Wow.
And he was the one that was worse
And
than
you're
my
just
mom.
holding that big old thing
Yeah,
right there like
just
it's
the-
nothing. And,
But ma, just the tip, like only that much goes.
Yep,
in that
that's what
phone.
he said.
Girl, I cannot take it. So just the dip. It's gonna be
Okay.
cold and pressure.
Okay. I'm gonna try to
I'm gonna
relax.
show you your egg. You're gonna be so excited.
Okay.
What if you came back and you were pregnant from
Oh,
the egg that I
God.
told you?
Oh my gosh. Okay.
Do you remember seeing that clear mucus? Because that's pretty important. pressure?
I've been trying to think. Okay, hold on. Ooh.
Sorry. Worst part's over in 2 seconds. Done.
Okay.
Worst part's over. Good.
All right.
Sorry.
It's okay. I can't remember seeing it.
Okay.
Let me see what we're
Pay
looking at here.
attention now to it.
I definitely am.
Good. So the uterus looks good.
Okay.
The lining of the uterus looks good. I don't see any retain products. So that's
Okay.
good. I'm gonna do a 3D, 4D because I'm obsessive compulsive and I want to see if there's anything like lurking behind or anything.
Okay.
I'd be so excited. Oh, you got, look at these eggs, girl. Okay.
Where? All the dark black
Yeah.
spots?
That's on the right side. You're totally fertile.
Okay.
Transverse right. But things may be a little wacky because because you had the miscarriage.
Okay.
Look at those eggs, beautiful. That's all on the right. I'm going to show you the left in just a minute.
Okay.
I'm going to listen to blood flow on the right ovary because that's what we do. Good. Perfect. So every organ in our bodies have an artery and vein that supply them blood. I don't see a fibroid.
Okay, good. No fibroids.
No fibroids.
You scared me earlier. I was like,
sorry.
Oh no.
Sometimes there's just area of heterogeneity. It might be it's right here, but it's not defined enough for me to say whether it's going to turn into a fibroid or just...
Is that the thing you were talking about a cyst? Or no, that's something different.
Yeah.
Okay.
Fibroid is used, that terminology.
You're pushing further back there.
I'm sorry. We'll see what my radiologist says. If he thinks it's just quite ill-defined and it's very small. So it could be, if it is an early fibroid, it's not anything to worry about. It's at the top of the uterus. It's super small and non-threatening.
Okay, good.
It's not going to harm a pregnancy. It's a centimeter. Super small. Now let's go to the big egg on the left.
Okay.
Here we go.
Oof.
And then you got another one next to it.
I see it right there.
See,
I wouldn't have known what I was looking at until you told me.
Yep. The cool thing is my radiologist is super cool. He's an older guy.
Okay.
And he's like, Kira, you have so much experience. Please, if you can reassure your patients, I allow you to tell them what's going on. Okay. Which is cool.
Awesome. Yeah, because most of them will say you have to wait to talk to the doctor.
Right. That's why I wanted to tell you. That's not the norm. But he gives me that privilege. So.
Okay.
Which
awesome.
I like. Of course, if something was really bad, I wouldn't be the one to tell you. But, when I see a beautiful
Well, would you even say, the hint to me that there's something bad or no?
There's nothing bad.
Okay, good. Oh, you would say that. Or say nothing at all.
I would say nothing.
Okay, gotcha.
So, beautiful egg.
Okay.
I suspect, because you don't get your periods, you still ovulate. So, I'm going to do the 4D on this.
Okay.
We're just sweeping through. The computer does it all on itself. Look at that.
Cool.
Oh, it's so cool. Super, super cool. Okay, then we're going to look inside the lining of the uterus to make sure. You're perfectly photogenic. Everything looks status quo.
Everything's smiling at you.
Everything is smiling at me. So that's good news.
I want to know, maybe because you got experience in so many things, is there an explanation why my pelvic is so narrow? Because once I went to the hospital and the doctor didn't believe that I had all of my children naturally. He was like, how? And I'm wondering if that's why sometimes in the beginning, when I had sex, honestly feels like I'm over again. And I know that's probably traumatizing to some people. But after a while, and I know what positions and how to move where it's not. But is there a reason? Because he literally said there's no way you pushed out 5 children. Your pelvic is so narrow.
And you're like, honey.
Are you able to tell while you're in there or no? That's what I was going to ask you. No? So you
only
can't
if
see.
Only if I were to do an exam or the provider, if Teresa were to do an
Gotcha.
exam.
Okay.
Yeah. But your cervix looks good.
Okay.
The uterus looks good. You may, as I said, if you do have a fibroid, it's super small. And the ovaries look good. There's no retained products of conception. That's the egg in a long view. That's a beautiful egg. Let me see.
Okay.
Long left. Let's see what that measurement is. Yeah, so in its largest dimension, it's almost 1.8. We want it to be 2.2, 2.4.
Okay.
So, yeah, start looking 4 days from now.
Okay.
And see. But Not everybody will get that mucus.
That's what I was
but
gonna
want
ask you.
You to pay attention.
Okay.
Like really start looking about 4 days from now, and it'll be generally clear, but it'll be like jelly.
Okay.
You should. If you're ovulating, I'm gonna take this out. We got everything we need.
Okay. Go ahead.
Sorry. Sorry.
It's okay.
So I would assume that your pregnancy test is 0.
Okay.
Because I see no products. If I saw a sac or I saw debris, sometimes it'll still stay positive.
That's what I was gonna ask, because they would have to kind of vacuum that out, or
Yeah.
I don't know.
You don't need that.
Thank gosh.
Right.
I was so scared. I was
And
like,
tell me when you were bleeding this whole time, did you pass like clots? Was it a lot of blood? Was it like a period?
Yeah. I got pictures. I don't know if you want to see them, but yeah, I got pictures. You do?
Yeah.
Okay. So I go to the next room, or you said the
I'll
hallway?
meet you and take you to the next one.
Okay. Thank you.
You're welcome.
She's so cool. She was explaining to me about tubal pregnancies. I showed her my picture from my other ultrasound. If I can remember, I insert a picture. And she was like, there's the sac right there. It's a little black dot. I said, they told me they couldn't see a sac. She said, that's it right there. She was explaining to me, maybe they thought it was a tubal pregnancy. So, yeah. All right. I'll see y'all in a minute. Am I the only one that cleans up my mess at the doctor? And I hate when people leave their drinks and stuff like this. Like, everybody's not nice. Somebody can put something in your drink.
Okay, friend, let me weigh in before then you're gonna go right
Oh,
in.
no. What is it?
132 over 82.
Okay.
Okay.
So that's good? That's okay?
Yeah, that's borderline.
Okay. So they took it the other day and it was like 180 something over something. And they took it again. They were like, I don't like that. I'm like, I've never had issues with high blood pressure. So she did it with a different one.
Right.
With the, I don't know, the one you push the button. Yeah. And it was like 119. So I was like, yeah, I know that's wrong.
Yeah.
Why'd you ask? Like, is it normal to be in pain after a miscarriage? Or?
No, really. Some people are fine, you know.
Oh, okay.
They don't have any issues, yeah.
Okay.
You went to the hospital for that?
Yeah, I first went to the hospital, but it's been dragging since I've been trying to get an appointment in here. It's been hard, so we don't know when I had the miscarriage or not, but I guess it's official today, which I was already assuming that. So that's why I'm not taking it so hard now. I just have to go back to my old doctor, the one that delivered my other children. I don't know. Not to talk bad about your job, but baby, never again. It was just too much.
I understand, my dear. I have 3 children, so.
Yeah, you gotta go where you feel like your care is better and are taken care of. And your concerns are, appreciated.
You allergic to any medications?
None known.
Well, my daughter got a miscarriage, that's why.
Really?
Yeah.
How far was she?
She was like a month. She went to the hospital because she was bleeding a lot and she miscarried. She was very sad.
Yeah.
Because that was her first one. And then, and she has
Her first pregnancy?
Her pregnancy.
And no more after?
No more. She didn't want to.
Oh, she was scared to go through that again.
Yeah.
There.
Let me check here. I'll tell you. Usually it's here. It was 2004?
Yes.
Okay, 2004. Okay.
I thought you were going to say it like that too. Like, huh? Because most people say, how?
And then your last pap smear?
It should be a year ago.
Miscarriage. You just The baby, you just started bleeding?
Yes, a lot.
Okay.
That's why I knew something was wrong, because I don't get a menstrual.
Okay.
So when I started bleeding, yeah, I knew something was wrong.
So let's see what else here.
So she basically told me, which I figured, that I had it in the toilet. She said it passed through in the toilet,
Yeah.
which I thought that too. I remember calling my husband. I said, "Come look. Do you think that's the baby?" And, oh my gosh! But I wasn't sure. Didn't know if it was just clots or what.
Exactly.
You know, I've never had a miscarriage before, so I'm Googling. I'm looking for stuff, and Google was right. People say don't trust Google, but everything I Googled, it was actually correct.
That was in this month
No, that was July.
when you had the miscarriage?
That's what we're thinking, but they gave me the results last week, just a few days ago, from here.
Okay.
After doing the blood work, and my HCG level dropped, the numbers, because they can't go by my last menstrual since I don't get a menstrual, so I always have to get blood work done.
Yeah.
And they look at the numbers. So the numbers was 1400 back in July, and it was negative something now, so meaning that I had the miscarriage.
All right, we're gonna check in everything, that I did everything correctly, so she can come and talk to you.
Okay.
So I'm checking everything, and I am so sorry.
It's okay. I'm okay, but thank you.
You're welcome.
I appreciate it.
Pregnancy.
It's okay.
Oh, mama.
It's okay. Thank you.
All right, but Kira said you got a lot of eggs developing.
Yeah.
So if you're gonna try again,
She said now's the time.
now it is, girl. All right, your labs, everything we did was beautiful except the beta HCG was less than 1.
Yeah.
So you must have miscarried during the bleeding episode, and it happens.
Yeah.
Unfortunately.
I figured it was that. That's why I'm kind of okay now, because I assumed it for
Yeah.
so long. So.
And everything's clear on the ultrasound. You have a small fibroid, but that shouldn't interfere with getting pregnant and
So I
carrying.
do have a fibroid?
A small one.
Okay.
Yeah.
So what does that even mean? What
It's okay. So like when you're old, you start getting these weird growths all over you.
like moles or something,
Yeah.
kind of like that?
Yes. So you get them in your uterus too, and they're fibroids. So
Okay.
depending on where they're located as to what kind of problems they cause, most women have one or more. If you're unlucky, you've got a lot.
Yeah.
But yours should not interfere with a pregnancy.
Okay.
So,
Of course, you're a doctor, so you got to use the safe word. Should.
Yes.
Shouldn't.
Right. Right. I can't
Make promises.
I'm sorry,
I
I was
know.
eating some pretzels.
It's okay. I understand. You can't make promises that.
Right.
Can it grow? Like fibroids can grow?
They can.
Or multiply, like you said?
They can grow.
Okay.
And get bigger. The thing we get concerned with is their location, and yours was up high, so that usually doesn't cause any problems.
Okay. But they don't go away? Do they go away?
Eventually, when you go in menopause, when your periods stop and the hormones stop.
Question.
Yeah.
I've asked so many different doctors, but when will I go in menopause?
So how old was your mom when she went through menopause?
I have no idea.
Okay.
Like, I don't know.
So the average...
But because I don't get a menstrual, and you said when my
Yeah.
menstrual stops, so...
So... Yeah, that's a tough one.
I could already be going, like, do you bleed, or it's only when you stop your periods, that's when menopause stops? Because I'm always hot, and I normally am cold, and I'm just like, oh my God, I was burning up, and my husband and my kids say, it's 60 degrees in here.
So, the average age is 52 for menopause.
Okay,
The
that's what I
average
thought.
age.
You did that. So, yeah.
I would say in 6 months, if you're not pregnant again, to come in or send me a message through the portal, and I'll order some menopause labs to make sure your ovaries are functioning right.
Okay.
Okay.
And you say, what is it called again, where you can make me have a period? And
Yeah, I can give you progesterone so that you have a period every couple months.
I
It's
thought
not
it started with
really
an I, something you said.
induce.
Oh, you said
yeah.
induced.
Yeah.
Okay.
So, expecting again.
Okay. I'm pretty baby.
Got some good eggs.
Yeah. Can't believe they got all the food in there. Y'all ain't saving me no food.
No? Oh, let me go get one.
Okay. Whose birthday is it again? Oh, happy birthday. How young are you? Because you look like 24 or something.
32.
32? Oh. Well, you know, you got good genes then. You're welcome.